Centre for Disease Control says it has ramped up the procurement of COVID-19 vaccines for the continent. Africa was previously reliant on the COVAX facility for vaccine supplies. Businessman and philanthropist Strive Masiyiwa has lambasted COVAX for the delay in the delivery of much-needed vaccine doses. Masiyiwa has been tasked with the responsibility of assisting Africa to procure personal protective equipment and vaccines. At the same time, Africa CDC Director Dr John Nkengasong says they're monitoring the impact of the Delta variant that's currently prevalent in some African countries.
I have been extremely critical of the COVAX facility for some very simple reasons. In our capacity as AVAT, John and I are responsible for coordinating and monitoring the supply of vaccines. And we met with COVAX, and we meet with COVAX almost on a weekly basis. And we met them back in January. And what we were keen to establish was, what were their shipments? We wanted to know exactly, what have you bought? Which vaccines are they? When will they arrive? Because it's our duty to the member states. We are the ones who report to the member states so that the member states could plan. We were given a schedule in writing that we would receive vaccines from the end of February, going through to December. We went back to tell that to the member states. We shared that data to the member states. We were not given material information, such as actually they didn't have the money, they were still trying to get money, that pledges which had been made by certain donors had not been met. That's pretty material information, which had we known that actually this was hope and not yet reality, we may have acted very differently. So our own planning was that we were supplementing what they were doing. Because after all, the donors had met as far back as June 2020 and said that they were going to give COVAX $8.2 billion. So many countries were just sitting back saying, the vaccines are coming. We found ourselves in March scrambling. Okay, now we're told that it's India's problem. We think the problems are much deeper than that. Okay, and certainly, if you have a problem, you must treat others with the respect to be able to go back and to say, listen, this was our best endeavors. We are not able to do anything. See what you can do for yourselves. We, as Africans, are disappointed. Okay, and I will say that again and again, because it's a long way from 700 million doses to 30, 40 million doses. Okay, so let's be clear with each other. Where we are right now, the situation may have been very different had we known back in December that, listen, this help is not coming. Do what you can for yourselves. But that's not the place where we were put. And it's sad that we should be in that situation.
We know for sure that the current vaccines that we have are working well against the Delta variant. So the Delta variant transmits about 40% more than the usual variants. Of course, it means it causes death and overwhelm your health system. But in terms of vaccines efficacy, we have no evidence so far that the vaccines that we are using, be it the Pfizer, the Johnson & Johnson, and others, are less efficacious against that particular variant. We had very clearly the B135 variant from South Africa was problematic against the use of the AstraZeneca vaccine. So far, that is that is the science we know. And that's why we are very confident and really are in urgent need to move the Johnson & Johnson vaccine. That particular vaccine has also been studied across different variants, and it tends to hold its own in terms of producing neutralizing antibodies at sufficient levels. All the vaccines that we have out there, if you challenge them with the B135 variant, they reduce the neutralizing antibody level, but not significantly. That would not give you enough protection. The only vaccine that knocks it down that very significantly, that is from this variant, is the AstraZeneca vaccine there. So that is what we know, that is what science is telling us. What does this mean in terms of the continental approach? It means that we need to analyze the variants more frequently to see the shift. I mean, as one of the colleagues, I think Gabriela from the Wall Street Journal asked, what is the main variant driving the third wave in Zambia? We know for sure that the B61 variant, that is the Delta variant, is in Zambia, but we don't know the proportion. Okay, that is what should be of interest to us, not just whether you detect a variant, but what is the proportion of this variant compared to other variants there? And they tend to evolve very quickly. If you look at DRC in March, the first Delta variant was identified in DRC in March. And as of today, it has become the predominant variant in DRC. So I can affirm and speak with certainty that that is the variant driving the pandemic in DRC. But we still have to see the data in Zambia. And again, we have no evidence that the Johnson & Johnson, the Pfizer, the Moderna, or even the AstraZeneca vaccine are less efficacious against the Delta variant.